Yes, certainly does. So, when we think about vulnerable populations, the elderly comes to mind. Populations greater than age 65, for example, they could bear a higher risk of having more severe COVID disease and should be prioritized for treatment. And so, for example, last year in 2023 in the United States, for hospitalizations due to COVID-19, nearly 2/3 were in patients who are aged 65 or older. And among in-hospital deaths last year, nearly 90% were due to age 65 and older. And so there's a challenge of increasing age that's associated with worse COVID-19 disease outcomes. But also when we think about advancing age comes additional comorbidities. So as people age, they acquire more medical problems. Hypertension, diabetes, heart disease, all of these are important. And these can also raise a person's risk for progressing to more severe COVID disease. And so it's also important to recognize that getting admitted to the hospital with COVID, often these patients can not only require hospitalization, but also possibly require a stay in an ICU setting. And so COVID remains a significant challenge. And some providers even are having an approach where there's a sort of watch and wait approach to treating COVID-19. And that's also can be challenging because the most effective therapies for an antiviral is to give a therapy right away, particularly in patients who are higher risk. And so it's really important to have prompt treatment of these patients to reduce the risk of severe disease and death and progression throughout the hospital. So these are some of the challenges that we see in vulnerable populations, and also in some ways, generally speaking, in the care of COVID in general. So Remdesivir is the antiviral standard of care for hospitalized patients with COVID-19. This includes both adults and pediatric patients. Even outside the hospital for outpatients, Remdesivir is recommended for adults and pediatrics who have a risk of progressing to severe COVID-19 disease. And so the label for Remdesivir now includes vulnerable populations. So if we think of pregnant women in second and third trimester, for patients who have severe hepatic disease or severe renal impairment, there's also indicated for those populations as well. And so the foundational data comes from randomized double-blind controlled trials. And the data has also been supplemented widely with real-world evidence. And so real-world data has been used regularly to also continue to support the data from Remdesivir. And this is across different variant time periods. So not only just in the beginning of the pandemic, but also now in current times in Omicron, and also in populations, such as immunocompromised as well. So again, continuing to generate data to show the benefit of Remdesivir in those populations. At the AskMed Global Conference earlier this year, last month, Gilead presented new real-world evidence that examined the impact of Remdesivir and how it showed reduced mortality for elderly patients. So those above age 65 who are hospitalized for COVID-19 compared to the same age population who did not receive Remdesivir during the course of their hospitalization. So overall, Remdesivir was associated with a significantly lower 14 and 28-day mortality compared to those who did not receive Remdesivir in the hospital. And so furthermore, thinking about this effectiveness of Remdesivir, this was consistently observed in the group overall, but also in groups when you segment by oxygen requirement or severity of disease. So for example, reduced mortality was shown in patients who did not require supplemental oxygen, those who did require either low flow or high flow, also those in non-invasive or mechanical ventilation or even ECMO. So across the board, this mortality benefit was observed in this real-world evidence study that was presented. And then finally, when we think about the overall population that's above age 65 in this study, even when you segment the population, for example, age 65 to 74 or 75 to 84 or age 85 or greater, the reduction of mortality benefit in the population was also seen in each of those groups as well. So it was not just the very, very old, the oldest in the group, but it was also consistently when you break down the elderly population in the study. So the clinical implications is really, it's important to recognize that COVID is still here to stay. We have an environment now where people's immunity to COVID from receiving, from getting infected or from the vaccines is continuing to wane. The variants continue to evolve. Uptake on booster vaccines is actually low as well. And so with COVID here to stay, it's really important for healthcare professionals to ensure that they're really adhering to the most recent guidelines for the treatment of COVID-19, especially for people who are hospitalized and those are at highest risk of severe disease. And so when we think about antiviral therapies such as remdesivir, these stop the virus from replicating, and it's critical in patients who are at risk of disease progression to be able to administer that therapy early. And so treatment guidelines such as the NIH's or National Institute of Health's COVID-19 treatment guidelines recommend remdesivir in patients, either remdesivir alone or in combination with a corticosteroid in patients who are hospitalized for COVID-19 who require supplemental oxygen. And so giving these antivirals early can, benefit the patients and prevent disease progression, regardless of symptom onset and severity. So it's really important to get the antiviral therapy on early, and remdesivir has shown that. So I think as a result, healthcare providers should really stay on top of the latest data and the innovations in COVID-19 and to treat as soon as possible, and really to do the best for their patients to reduce the chance of progression of disease and mortality and death. And remdesivir has also been shown in separate studies in looking at real-world evidence in other types of populations, not just the elderly, but also in other vulnerable patients, such as immunocompromised patients, patients with cancer. And so, with the mounting evidence, even through the current era of Omicron, the importance of treating patients at risk of severe outcomes for COVID-19 is paramount.